Well, if you know by now, it is Wednesday morning and it is time for another About Mansfield Consumer Advice Series episode. Hello, I'm Steve Casillo. Appreciate you being here today. We are live on Facebook, or you could be watching the video replay on YouTube or LinkedIn. You could be right now listening to your podcast on your favorite podcast platform. In any event, we appreciate you being here today. And today, as always, as we do on Wednesdays, we bring in Dr. Jordan Adams. First of all, welcome back. Say hello to the audience.
Hello, good morning, everyone.
And we've been doing our series on pregnancy, which is something that you love to work with, pregnant women, and in this case today, postpartum women. And they're at Calibration Chiropractic and Functional Health in Mansfield, Texas. And today, again, talking about postpartum tension headaches. And so let's just jump right into the water. First of all, what is a postpartum tension headache and what causes them?
A postpartum tension headache really isn't too much different than most other tension style headaches. So, a tension headache, by definition, is typically going to be a knot that starts in your neck and then it builds a rubber band like tension pattern up around your head. It can go in a pattern going from the neck straight up, or it can be a band around your neck. But with postpartum specifically, what we see a lot is, and I know from firsthand experience, I dealt with postpartum tension headaches with both of my kids, and I'm so fortunate I've had chiropractic care to help navigate that. But we're dealing with, not only are you trying to recover from giving birth to a baby, and now you're trying to take care of this baby and also trying to sleep and get enough food and drink enough water. And it can be really hard to accomplish all of these things. And on top of that, the posture that you take on to care for your baby, whether carrying them around throughout the day, baby wearing, and nursing, can all contribute to poor postural patterns that lead to tension type headaches postpartum.
So again, breaking down the symptoms, it's starting in the neck, working really, and would this be similar to a migraine?
So it's very different than a
Oh, very
migraine.
different than a migraine. Wrong again, Casillo. Go ahead.
Tension headaches are going to be muscular in nature or stress related. Now, a migraine postpartum is typically going to the symptoms are going to be a very strong throbbing type sensation, typically on one side of the head and often associated with nausea and vomiting. But what we see a lot with these postpartum migraines is they're typically hormonal in nature, meaning that our estrogen levels after birth drop dramatically. And that hormonal shift can be catastrophic for migraine type head pain. Additionally, one thing that I'm currently researching is the iron impact and how our iron stores tend to get lower postpartum in those initial few weeks because we're losing a lot of blood. And that can set us up for migraine type pain too, due to the lack of oxygen in our red blood cells, because iron gives oxygen to red blood cells, and that gives the lack of oxygen to the brain, which can set up a migraine.
All right, and again, some of these causes being lack of sleep, which
Lack
which I think every woman, every brand new mother goes through. Lack of sleep, a drop in hormones, nutrition, all plays into postpartum tension headaches. What are some of the treatments? What are some of the things that you do to help out postpartum mothers?
So let's start with the tension headaches.
Okay.
So aside from getting adjusted, because as chiropractors, we can help to see if there's any dysfunction in the neck, whether in the musculoskeletal system, but also giving ergonomic tips. So helping moms navigate how to properly sit when they're nursing their baby. And to give you an example, that's if you're sitting, you're going to have your feet flat on the floor. You're going to scoot back all the way up against the chair that you're sitting in. You're going to make sure your shoulders are relaxed. And most importantly, bringing baby to you instead of hunching over to bring yourself down to baby. I see that a lot. And then also, trying not to look down at your phone the whole time that you're nursing is going to create a lot of tension and buildup of pain in the neck, which is going to lead to those tension headaches. Now, for the migraines, while we can't cure those with chiropractic, we can help moms navigate lifestyle interventions. So, whether that's nutritionally, like are you low in iron, as we mentioned earlier? Are you getting enough healthy fats? Because those healthy fats have a hormonal benefit to them in how your body is navigating hormones, but then also, how are you sleeping?
Right.
Yeah, so we have lifestyle conversations with our patients about how to navigate some of these problems.
I would assume exercise would play an important role in reducing the headaches. Yeah.
Yes, you do have to be careful the first couple of weeks postpartum about not over exercising. Now, it's okay to go for a casual walk, but you definitely don't want to jump right back into your gym routine. And you have to be very careful to listen to your body. But over time, past about 6 weeks, as your body is starting to heal and recover, getting back into a healthy movement routine and exercising is going to be really beneficial for blood flow and strength and stress management and helping aid better sleep.
Right. And it's now I'm obviously not a postpartum mother, but I have become very aware of keeping the body moving during the day. I do a lot of editing of videos or audio podcasts, and really I'm focused on the computer for hours at a time, sitting in a chair. And there will be times where I notice I can't move my neck. And after hours of just having it focused on the computer. And I would assume if someone, if a brand new mother is sitting in a chair for hours and hours, nursing. In fact, we're going to get into nursing in here in just a few seconds. That they too can start to lose mobility because of lack of movement. Does that make sense? Or am I on the right track here?
Yes, you are. And it's really important. So you mentioned exercise, and there are some simple stretches that you can do to help loosen up those muscles so that, as you said, like if you feel tight and then you're like, oh my gosh, I can't move my neck. Doing some simple neck circles or extensions, like looking up at the ceiling, doing some side bends, just gentle motion to help re-loosen everything can be really beneficial.
Let's talk about nursing now. That again, that plays into obviously the postpartum and I'm just going to tee it up and let's talk about nursing and how your practice plays into that.
So I shared some of the ergonomic tips just a few minutes ago, about making sure your feet are flat on the floor and scooting back against the chair and bringing baby to you. But these are all really important because the average nursing mom, if they're nursing for a total of 1 year, they're going to be nursing on average somewhere around 1,800 hours. It's 1,800 hours on average, give or take. And if you think about that, that is roughly about 75 days or so. So that's a long time. If you're not adopting a proper posture, it's a long time to be spent in one position. And so when we navigate these, we're also keeping in mind the long-term trajectory and long-term effect. The other side of this is, when you're nursing, you're needing a higher energy threshold. So we talked about how certain things can contribute to headaches, and not eating enough is certainly one of those. The average nursing mom needs roughly 300 to 500 extra calories a day. And so set up a nursing station, keep snacks, keep water there, keep yourself hydrated, and make sure that you are eating enough food to sustain the milk that your body is producing.
In the minute or so that we have left in this 10-minute nugget of information, is there anything else that you want to add before we get into your contact information?
So if we stick with the posture of nursing, let me also add that if in a slumped posture, this can impact rib function, diaphragm function, and pelvic floor function as well. So when I'm coaching moms in how to adopt a healthy posture, it's bigger than just the headache and the neck pain and the nursing. This is actually a full body effect, and how we stand, how we sit, how we carry babies, how we walk and stand and sit without babies too, has an impact on the whole body. So it's important to keep everything in mind as everything is connected.
And if someone out there is either A, experiencing postpartum tension headaches, or B, knows someone who is experiencing said headaches, or is going through now, because we've also done our series of first, second, and third trimester episodes, and you can go back through the archives and watch those. If someone had questions, how can they reach out to Dr. Jordan Adams?
The easiest way, as always, is our website, calibrationmansfield.com, that has all of our contact information on it.
Dr. Jordan Adams, appreciate your time, and let's do this again next week.
See you then. Bye.